from our conversation last week, we spoke about polycystic ovarian syndrome and how insulin has a direct effect at inhibiting the ovary's ability in a woman of converting testosterone into estrogens. All estrogens, which is a family of hormones, were once testosterone. And then women just convert more of that than men do, but men, of course, convert some as well. I'd like to actually kind of start this conversation, this lesson, by focusing on the fat cell, because once again, I think we can start in the fat cell. And then depending on what's happening in the fat cell, we have those two consequences, those two pillars of male infertility, which is erectile dysfunction and low testosterone. Again, I think they're kind of derivative of a problem that starts in the fat cell. So let's just pick one. Let's start with erectile dysfunction, because there was a paper published, and this article that I'm thinking of right now was published in 2013, and the title of it is, and anyone could just go look up the title, it's Erectile Dysfunction May Be the First Clinical Sign of Insulin Resistance and Endothelial Dysfunction in Young Men. So that's a pretty compelling title for a scientific manuscript, because it's basically saying, if you have a patient who's complaining about erectile dysfunction, it's very likely that this is actually a problem of insulin resistance. Now, briefly, let's talk about how that connection works, and then we can get into low T. With erectile dysfunction, it's thought to be a problem of blood vessels that don't dilate well enough. So a normal erection only happens when those blood vessels dilate. And as they dilate, well, then the man has the erection that he's hoping for. If they cannot dilate and they stay constricted or narrowed, no erection, or certainly an inability to keep an erection. Part of the process of dilating that blood vessel, making the blood vessel get bigger and carry more blood, is the production of a molecule called nitric oxide. Yeah, so nitric oxide is so good at dilating blood vessels that if someone's having chest pain, the reason a physician will give the person a little nitroglycerin pill to put under their tongue is that nitroglycerin will be taken into the blood and converted into nitric oxide, opening all the blood vessels and easing the chest pain. Now, to take it back down to the erection, in the case of insulin resistance, when the endothelial cells, which are the cells that are lining the inside of the blood vessel. So if we were inside a blood vessel right now, as we were looking around the tube, we would see the endothelial cells. Those are the innermost lining of the blood vessels. The blood vessels, these endothelial cells, are what's making the nitric oxide, which then will allow the vessel to dilate. If the cells are insulin resistant if those endothelial cells become insulin resistant, they cannot produce as much nitric oxide. And so when there's a signal for those blood vessels to dilate, if there's insulin resistance, then they don't dilate, they stay constricted. So that's a direct effect of the insulin resistance compromising the ability of the blood vessels to make nitric oxide, which is then compromising the ability to either get or sustain an erection. You can imagine that systemically throughout the entire body, if we have a whole body of blood vessels that don't dilate and they're all staying very constricted and narrow, now you have elevated blood pressure throughout the entire body. And that's why insulin resistance, that's one of the reasons why insulin resistance is so connected to hypertension. So you have these two sort of blood vessel problems happening coincidental or in parallel, hypertension throughout the body, and yet a lack of high blood pressure where you want it in the case of the erection. Someone might be wondering, well, why did he even bring up the fat cell at the beginning? It's because insulin resistance starts at the fat cell. So if you have an insulin resistant fat cell that's spreading the insulin resistance throughout the body, including to the blood vessels that are responsible for erection, and then now those blood vessels can no longer generate enough nitric oxide to dilate the blood vessels and move enough blood to develop an erection.
So when my clients come in, and there's lots of therapies out there that are being promoted, like ultrasound therapy, all kinds of medications. If they get their insulin resistance under control, is that a treatment for this?
Oh, yeah. So I have to speculate a bit because I've not seen a study that has confirmed that. But yeah, I would be extremely confident. So I'm an informed speculation to say, yes, that I would think this would be a conversation someone could have with their physician. And I'm not their physician. None of us are. So I'm not telling them what to do. But I would think insofar as erectile dysfunction appears to be a key manifestation of insulin resistance, well, then go to the insulin resistance before you start messing around with any other sorts of crazy therapies. And the benefit is you're going to improve a lot of other things too. Maybe there is a specific therapy or a drug like Viagra. Okay, this will improve your erectile dysfunction, but it's not going to improve your excess weight, your diabetes, or your hypertension. Why not address all of those things by addressing what is a common cause to all of them, insulin resistance? So that's my perspective on that. Now,
that's great.
The other phenomenon is low T. That the degree to which someone's low testosterone is causing problems in the man, that is not well supported by the evidence. So I will go on record by saying I think the whole low T movement is a bit of just a way to sell drugs. For the record. Now that might be a little controversial. Now, nevertheless, let's say, what if, because a lot of the problems they say, like when you listen to the radio ad, it's, are you feeling like you don't have energy? Are you gaining weight? Yeah, that's just because you're getting old on one hand, and you're insulin resistant. And so a lot of what you're feeling is the insulin resistance, not the low T. But as men become progressively more overweight, they can experience something called hypogonadism, including a potential for lower testosterone production. So maybe there's something there. But again, I don't think it's as widespread as the average radio ad makes you believe. However, back to the fat cell. I mentioned earlier how in the ovaries of a woman, and the same thing happens in the testes of a man, just to a lower degree, there's an enzyme called aromatase. And aromatase is the enzyme that will convert the testosterone into the estrogens. In polycystic ovary syndrome, the high levels of insulin are inhibiting that aromatase in the ovaries. Now, what's interesting in the man, it doesn't seem to happen that way in the testes. What starts to happen is that as the fat cells get bigger, they start to express this enzyme called aromatase. And as the person has more and bigger fat cells, now aromatase is more active than it was before. And so now this man's fat cells are taking in the testosterone that was made in the testes, and the fat cells are converting the testosterone into estrogens. And so it's almost like his fat cells are acting like the ovaries in a woman. It's like there's an ovary in his fat cells. Now there isn't, but it's acting like it with regards to that one single enzyme called aromatase. So it's not his low T that's causing his weight gain. It's his excessive fat that's causing his low T, if it's actually low at all. And there's so much discussion and obsession on increasing testosterone levels. But the fact is, men have wildly differing levels of testosterone, and they in no way predict who's going to be more Adonis-like than someone else. It just doesn't appear to actually matter as much as most guys like to think. I mentioned a term earlier called hypogonadism, which it is much more common in men that are overweight or obese. And that is both the tendency for lower testosterone production, but yes, also lower sperm count or lower sperm motility. It's interesting to note and to see the degree to which environmental influences can affect a man's sperm production and sperm quality. For example, there was a study done by Loma Linda University years ago that found that when you shift a man from an omnivore diet to a vegan diet, his sperm production drops. And actually depression goes up, which might be related directly. Hypogonadism is real. It's very much a phenomenon that accompanies obesity in a man, and that includes lower sperm production.
Yeah.
Thereby directly, so the erectile dysfunction and compromised sperm production, those, of course, would be hallmarks of reduced fertility in a man.
Almost 100% of my morbidly obese men, that's one of the first questions. Typically, they've never been tested. They are just buying into what the radio and the TV is telling them. What's interesting, Ben, I wonder about this, is that as they start to get healthy, as their cells start becoming more insulin sensitive and they start losing their fat, is one of the reasons they start feeling so good is because they are increasing their testosterone?
Yeah, it's possible. It's possible. I confess, I do think testosterone is sort of overhyped in many regards. If the person really did have a suboptimal level of testosterone, although again, that varies so much, it's so hard to really know. But if he did, then yeah, absolutely. Putting testosterone back to a normal range would very likely help him feel better. But I don't think that's it. Even if testosterone does change, and there's no evidence to suggest it really does significantly, I think it's going to be more a matter of you're improving your insulin sensitivity and you're losing weight and you just feel better. We're not healthcare providers here, but I do not believe, unless it is truly clinically confirmed that this man lacks testosterone, which is not common, I don't think there's any need to start supplementing with testosterone. I think that's just a way to make a guy's muscles grow, and his prostate, unfortunately, and he'll look a little more muscled and feel a little better, but he can never take a leak.